Good afternoon, and thank you for joining our webinar called "It's Time to End the Wait" about our 2020 legislative proposal to end the DD waiting list and build community capacity. My name is Jensby. I'm the Senior Director of Public Policy and Operations for Alliance. And before we get started, I just want to go through a couple of housekeeping items. For this webinar, all lines will be muted, so you won't be able to ask questions through the phone, but you can send those through the chat box or email us after the webinar. Our webinar will be recorded, and we'll be sending out a recording of the webinar and the slides to all attendees next week. The recording and slides and all resources associated with the webinar will also be posted on the Alliance website in the coming days. We may not have time in this webinar to answer all questions that may come through the chat box, but we will be sure to compile any relevant questions that we don't answer through the webinar and send those out with the recording and post them on the website as well. I am one of your presenters today, and I'm joined by my colleague Emma Hudson, our lobbyist with Emma Hudson Consulting. I'll be turning over the presentation to her in just a few minutes. But first, we're going to start with the agenda. All right, so we're going to talk about what Alliance is, so you have some background on us, go through some helpful definitions for acronyms we're going to be using during the webinar, talk a little bit about the waiting list, background, and how it works, talk about community capacity and the importance of that in relationship to eliminating the waiting list. We're going to talk about our legislative proposal, the process for the bill and where we're currently at in that process. Most importantly, how you can help us make this legislative proposal a success. And then we're going to go over some frequently asked questions. Finally, at the end, you'll get our contact information if you'd like to send us follow-up questions. So first, what is Alliance? We are a nonprofit statewide association of community-centered boards and program-approved service agencies that support people with intellectual and developmental disabilities all across the state of Colorado. We currently have over 70 PASAs in our membership and 17 community-centered boards. Our members serve over 10,000 people with IDD across the state, and about 80% of the people who are currently enrolled on the developmental disabilities waiver. So, you just saw one acronym that we're going to talk about. So let's go through some acronyms and definitions. We're going to say the letters IDD a lot, but we're referring to intellectual and developmental disabilities, specifically people who have intellectual and developmental disabilities and are served through Colorado's Medicaid waiver programs for that population. When we reference HCBS, we're talking about home and community-based services that are offered through those Medicaid waivers. The developmental disabilities, or DD waiver, is one of the adult waivers that serves this population. We're going to go into a little more detail about that in a moment. The supported living services, or SLS waiver, is another adult waiver that we're going to talk about in more detail. The CES, or Children's Extensive Supports waiver, is a children's waiver. We're going to maybe reference that a couple of times, but this webinar is not going to go into detail about that program. When we use the word enrollment, what we're talking about is the opportunity for someone with an IDD to enroll into one of these waivers. So we're going to use that term a lot during this webinar. And then the acronym HCPF, or HCPF as we will call it, references the State Department of Healthcare Policy and Financing that is in charge of administering and overseeing these waiver programs. And finally, DSPs refers to direct support professionals, or the frontline workers who support people with IDD. So I just want to go over a couple of waiver program basics with you. So what we're talking about here is Medicaid home and community-based services waiver programs. These programs support people to live in their own home and community instead of in an institution. They provide assistance with daily activities like eating, bathing, taking medications. There are a whole variety of services that are available to people who qualify for these waivers. Importantly, these waiver programs are not an entitlement like regular Medicaid is, which means that states are allowed to have waiting lists for them. And finally, they're funded about half by state dollars and half by federal funds. So every dollar that the state of Colorado invests in these programs, there's an additional $1 match from the federal government that helps support them. Now we're going to focus just on the adult IDD waivers, which is the focus of this legislative proposal. And sometimes people get a little bit confused about what the differences are. So we're going to talk about the supported living services versus the developmental disabilities waiver and what the main program differences are. So in SLS, people receive intermittent supports to supplement natural or unpaid supports that their family members or other people in their lives might provide. They're responsible for finding their own living arrangements. The average annual cost per person is about $14,000 in this program, and there's currently no waiting list. The General Assembly, through a budget action, eliminated that waiting list a few years ago. By contrast, the developmental disabilities waiver provides what are sometimes called comprehensive services, which means access to 24-hour supervision and support. Providers in this program actually support the person to find a living arrangement through a service called residential habilitation. The average annual cost per person in this program is about $72,000. So you can see that the services are a lot more robust, and there's a cost associated with that. There's currently about 3,000 people on the waiting list. We're going to go a little bit deeper into those waiting list numbers right now. So, how the waiting list works. There are two ways that people who are currently on the waiting list can access enrollment. One of the ways is through what's called reserve capacity enrollment. And this includes emergency resources, including the new caregiver emergency criteria that was added in House Bill 1407 from 2018. It includes people transitioning from children's waivers to adult waivers, and people who are moving out of nursing facilities or other types of institutional settings to the community. In order to fund these, the Department of Healthcare Policy and Financing predicts annually about how many people they think are going to need emergency resources and includes a request in the governor's budget for that amount in order to serve people. The other way to access an enrollment is through the order of selection, or what we might just call the regular waiting list. This is the waiting list that's managed on a first-come, first-served basis. And so people are offered enrollment based on the order of the date when they were added to the list. And this is qualified. Only people who are on the as soon as available waiting list are going to be offered enrollment in this manner, and we're going to dive into that on the next slide. So just hang with me. So if you're on the if you're enrolling through the first-come, first-serve or the regular waiting list, you can enroll when new enrollments are allocated by the General Assembly or when enrollments are vacated. So that means when somebody who's currently enrolled passes away, or they move out of state, or they switch to a different waiver program, but that enrollment becomes vacated, and so the next person on the list can be offered enrollment into the waiver. So, as I mentioned, there are two categories of people who are waiting. The first one is called the as soon as available waiting list. And these people have indicated that they would like to be offered enrollment as soon as it becomes available. So that you would think that that would mean that they would enroll as soon as they're offered the chance. Interestingly, and we're going to talk about this a little bit more later, we've seen with enrollments in recent years that there's about a 46% declination rate, which means that about 46% of people who have been offered enrollment through new resources that have been allocated in the last couple of years have actually declined to enroll. And that might be for a variety of reasons. They may have supports that are sufficient in their lives that they don't feel like they want to make that big of a change. They may not want to move into a different residential setting like a host home or a group home or something else. But there are a variety of reasons that people might decline, but that's important to keep in mind for what we're going to talk about later. There are currently about 3,000 people on the as soon as available waiting list for services. The other category of the waiting list is called the safety net. And this is people who have identified that they want to be on the waiting list, but they don't need to enroll immediately. So they know that they may need to enroll at some future time if the supports they currently have in place are no longer enough, but they're not quite ready yet. People who are on the safety net list can choose to switch to the as soon as available category at any time based on their needs. And there are about an additional 3,000 people who have signed up for the safety net waiting list. And some of those people also include people who have declined, who were previously on the as soon as available waiting list, were offered a resource and declined that resource. And therefore their case manager put them on the safety net list instead. So that's something important to keep in mind. So there have been a few efforts to eliminate the waiting list in the recent past. It's important to know that out of Colorado's 10 waiver programs, the DD waiver is the only one that still has a waiting list. And it's always been a long-standing priority for the disability community and the General Assembly. In 2014, House Bill 1051 was passed, which directed the Department of Healthcare Policy and Financing to create a strategic plan to end the waiting list by 2020. And they also have to report annually on the progress and the status of the waiting list. So each year when they present, they provide a cost estimate for eliminating the as soon as available waiting list, which in recent years has been around $200 million. So instead of eliminating the entire waiting list, the General Assembly has allocated money for some new enrollments in recent years. In 2018, via that House Bill 1407 that I mentioned, we were successful in getting 300 people off of the regular waiting list or the first come, first served category, plus an additional 150 reserve capacity or emergency enrollments for caregiver concerns in every year from 2018 on. And then last year, via the long bill or the state budget, they allocated another additional 150 enrollments. But there is not currently any long-term, affordable, multi-year plan in place to eliminate the waiting list in total. So I want to talk a little bit about some of the people that this impacts, because these are real lives. And I want to thank all of the people and families that have sent in their individualized stories so far. We put out a call, and everybody has given us permission to use these stories in our efforts, and we're using them, doing these little profiles like what you see on the screen. So this is Jean Marie. She currently lives in Fort Collins, and she was actually offered a enrollment to the DD waiver from some of those enrollments that have been rolled out in recent years. She waited 28 years before she was able to access DD services. She lived in a nursing home for 10 years, and she finally got community-based services in July 2008. She's now able to live in a host home, and she was actually able to go to a Rascal Flatts concert and go on stage, and she's part of a concert special on TV, which is pretty cool. But most importantly, she talks about how little choice she had in her previous living arrangement and a lack of staff. And now she talks about how she chooses nearly every aspect of her day, and this is the kind of impact that a DD waiver enrollment can have on a person's life. Now I want to focus on somebody who is still waiting for services. This is Brennan. He lives in Centennial with his parents. He's been waiting for DD services since July of 2007, so over a decade. He, like most young men his age, likes to hang out with his friends, and he wants to live independent and not have to have his parents, be around all the time to take care of him. So he wants to be able to move out of his home and have some roommates. And these are, very common desires that anyone has as a young adult. And they should be able to take advantage of that. So these are some of the real lives that have been impacted by either getting to enroll into DD services or waiting for them. We want to end the wait for people like Brennan. So here are some key takeaways about the waiting list, and then I'll turn it over to Emma. There are about 3,000 people on the as soon as available waiting list today. As I mentioned, people wait for years or even decades to receive these comprehensive supports, and there's no affordable multi-year plan to eliminate the waiting list in place. And very importantly, We know that if we're going to eliminate the waiting list successfully, we must ensure community capacity to serve new and existing enrollees. Now I'm going to turn it over to Emma to talk about community capacity, the bill, and why these things are all so related and important. Emma?
Good afternoon, everybody. My name is Emma Hudson, a lobbyist for Alliance, which means I spend my time working with legislators and helping to describe the challenges and opportunities that providers who offer services to people with IDD face as they work to ensure quality of care and continuity of care in their communities around Colorado. So we're going to talk a little bit about community capacity, and then I'll describe the bill we're proposing. So community capacity has been a long-term issue for all of these agencies. In Colorado, these waiver services that Ellen just described are provided by private agencies, which is great. It means that these agencies are provided in people's communities throughout the state. In Colorado, we have almost 500 provider agencies that offer these services. However, even though that sounds like a lot of provider agencies, and it is, the trouble is that due to a lack of capacity and low provider reimbursement rates, we have noticed that even though there's a lot of provider agencies, we don't see that reflected in terms of access and choice for provider agencies when folks are searching for services. These services are paid on a fee-for-service basis. So that means that a provider agency provides a service. So, for example, maybe they provide homemaker services in an individual's home, and they provide that for 15 minutes, and then they bill the state of Colorado for those 15 minutes that they provided that service, and then the state of Colorado pays them back a pre-negotiated, non-negotiable state rate. So for every 15 minutes they provide a service, they bill, and the negotiated rate is what they get paid. Right now, providers are competing to hire for employees with McDonald's, King Soopers, Good Times, you know, all kind of lower income employment opportunities. And the main difference here that we see is, you know, as things change in the hiring market around Colorado, all of those industries like McDonald's can increase their prices. They can just charge more for a hamburger in order to have the revenue to pay more for their employees. That is not an option for IDD providers. Also, unlike other Medicaid providers, so we've looked through all types of Medicaid providers, and that includes every type of service you might get in a hospital, home care services, all different types of Medicaid providers. To our knowledge, IDD providers are the only ones that rely on Medicaid reimbursements for 90+% of their total revenue. Truly, IDD providers, the vast majority of them, their entire budgets are Medicaid reimbursement rates and bake sales or other types of philanthropy. And that's important because basically when Medicaid is the only payer for the vast majority of these services, and there's very few people in the state who can do private pay due to the cost of these services, you end up with a pretty extreme disparity. In other Medicaid industries, they're able to access other payment streams. So, for example, there's private insurance, there's private pay. They can, some industries are able to charge co-payments for patients or customers. None of those things are possible in the disability space, right, in the IDD space. So specifically, as inflation increases or as minimum wage increases, we're unable to then pass that on to somebody who's, let's say, attending day program as part of their waiver. That results in what we call the perfect storm. So in Colorado, we've had pretty stagnant Medicaid reimbursement rates, coupled with rising inflation and rising minimum wage, which I'll talk more about in a second, along with very low unemployment. In Colorado, we have about a 2% unemployment rate, which is great from the perspective of our state being heavily employed, but bad from the perspective of ability to hire those sort of lower income staff who are able to provide these services. That, along with increased regulatory burden every single year, both from the federal and state government, there are more and more regulatory pressures placed on these provider agencies, which inherently increase costs and administrative burden. And finally, there are constantly increasing costs to service delivery models. So philosophically, the entire system is moving and has moved toward a person-centered model. Ideally, we would love for services to be provided one-on-one and from a perspective that really capitalizes on people's strengths and opportunities. That's only really possible when you have smaller and smaller groups, one-to-one, lower ratios of services. So all of those things combined have really increased the cost of care and lowered the amount that comes in to provide that care, which results in reduced purchasing power for providers, meaning lower pay and higher turnover for direct support professionals. Unfortunately, we see reduced continuity of services and service options, meaning we see major impacts on access to services for people on the waivers, and a lack of system sustainability and efficiency. You know, we have agencies that are foregoing offering certain services, and even agencies that are closing their doors on whole waiver programs. And ultimately, this results in reduced access and choice of provider for people with intellectual and developmental disabilities, and I know that's the last thing that any of us want. So we're working together to really try to increase capacity. To give you a little further perspective with some data, these recent increases have been really, really helpful. The last 2 years ago, we were able to get some really important, we got an important infusion of reimbursement rate money. Unfortunately, it's not quite enough because in 2008, IDD rates were set at 76% of the cost of delivering these services. Meaning, for every dollar of services provided, for every dollar of the cost of providing a service, IDD agencies in 2008 were paid 76% on that dollar. Ever since that time, it has only gotten worse. We have never, since 2008, been able to fill that in basically 1/4 of the gap in services. From 2001 to 2018, so for the last 17 years, inflation in Denver Metro and across the state has increased. In the Denver Metro area, we've seen inflation go up 47% in that amount of time. Meanwhile, these service rates have increased only 14%. You can see on the left-hand side the growing chasm between the orange inflation line and the blue IDD services reimbursement line. That is the difference between continuity of care, access, quality of services, hiring, and retention. That has increased over time. In the last 5 years, Colorado's minimum wage has increased almost 35%, and in that same amount of time, IDD rates have increased only 11.5%. That's really important to notice because as minimum wage goes up, which we sincerely support paying this population more, we cannot overstate how important these jobs are. They're incredibly high responsibility, really, really powerful impacts on people and families and communities, and yet they're typically paid minimum wage. We absolutely agree that those minimum wage jobs, particularly in this space, should be paid more. Unfortunately, all of those minimum wage increases, both state and local, are not accompanied by congruent increases in the reimbursement rates. For example, the city of Denver is currently considering an increase to $15 per hour in the minimum wage for the city. That increase is accompanied with 0 rate increase for these services, which means that providers in the Denver metro area or in the city of Denver would be forced to pay their staff $15 an hour, which is great from the perspective of, certainly we want to pay these folks more. Unfortunately, that money doesn't come from anywhere, and there aren't enough bake sales in the world to make that work. The governor's budget, for example, this year, the governor's budget was released on November 1st, and it included a 0.29% rate increase for Medicaid services. So all Medicaid providers, according to the governor's budget, would just get that 0.29% increase for the next year. Meanwhile, we know that 2019 inflation is expected to be almost 2%. So just in this 1 year, IDD providers would be losing 1.5% in purchasing power, meaning hiring and retention of quality staff. That has happened every single year for 15 years, which is why we've reached a pretty significant crisis point. All right. We have reduced availability of supports, and we have seen that specifically in rural communities. Already we are seeing the impacts of this. We have agencies in rural communities that are becoming pretty nervous about their long-term sustainability and ability to continue to provide services to their community. So there are agencies that have had to cease to offer a variety of the lowest reimbursement rate services, meaning their community is just no longer going to be able to access those services. Certainly that is not a solution where any of us are seeking. Years ago, the General Assembly eliminated the SLS and CES, so that's the supported living services, the other adult waiver, sort of the a la carte waiver, and CES, the Children's Extensive Support waiting lists, were eliminated several years ago by the General Assembly, which is excellent. However, they were eliminated without a long-term solution to system capacity and sustainability. And the impact of that we've seen in the community is what is called the invisible waiting list. Right now, we see people enroll in services. They go through the work of, coming off of the waiver, getting enrolled, and then they maybe qualify, for example, for 5 services. Let's say they qualify for respite, some employment services, homemaker, community connection, etc. But unfortunately, they can't find a provider who can actually offer those services in their community because the Medicaid reimbursement rates are too low. Some will maybe even never find a provider for some of the services that they're seeking. We want to be very clear that as we pursue this bill and as we collectively work to end the waiting list on the DD waiver, it cannot be an empty promise. We have to couple these services with a commitment to ensure capacity. So the key takeaways. Without a rate increase, IDD providers have no means of increasing their revenue or their budgets to keep pace with the increase in cost of doing business. It keeps going up every single year, and there's honestly no way to curtail those costs, and so we need to ensure that we can have a structural solution that will remedy that ongoing issue. Adding hundreds of people to an underfunded system just doesn't work. We've tried it in the past. The SLS waiver elimination was an excellent success for the IDD system and for people with IDD, but seeing that many of those folks are unable to access services means that we can't keep doing that approach. We have to find a way to ensure capacity along with this effort. We do not want to see an impact on access and quality of services over time. So if we're going to eliminate the waiting list, we have to ensure community capacity to enroll new and existing enrollees. All right, where are we now and what does this look like? How are we going to fix this problem? The solution that we are proposing along with our partners at the ARC of Colorado and Disability Law, we are proposing ending the wait over a period of 6 years, along with, so for 6 years, basically we're proposing a 6-year buy-down of the as soon as available waiting list. So you'll remember that Ellen described the difference between the as soon as available and the safety net waiting list. So for the next 6 years, we're proposing 500 people per year come off the waiting list in order of selection. So whoever's at the top of the waiting list now, those first 500 people would receive the services in year 1, and the second 500 people would receive it in year 2 every year for 6 years. And that would get us through the 3,000 people that are currently on that ASAA waiting list. Then after that, after the 6 years, it would be as many are eligible to enroll. So however many are left on that waiting list that year, let's say there's 100, 200, that's how many would be eligible. This would address the first come, first served waiting list category. And we have to, as just discussed, tie these rates to inflation moving forward. Sorry, folks, I'm having technical difficulties here. All right, so these rates are reimbursed on a non-negotiated unit basis, and the bill will ensure that these rates will be tied to the inflation index moving forward. So the index that we're using is the Denver Aurora Lakewood Consumer Price Index. It's called CPI, and that's the tool that the state uses to understand what inflation is looking like statewide. That's our best tool for the statewide average.
And I just wanted to know there that the ones that will be getting the inflationary increase are the rates that are reimbursed on a non-negotiated unit basis. There are a few services that are reimbursed on a negotiated rate or on a cost basis, so the provider provides that service and then gets reimbursed for the exact cost. Those will not receive the inflationary increase, so that was what we wanted to clarify with that bullet.
Yeah, and additionally with the 500 people per year on the waiting list. So what we know, as Ellen described earlier, is that the last couple years we have seen a 46% declination rate from families. So even though there are 3,000 people currently on the ASAA waiting list, we don't expect that the state of Colorado will end up needing to fund all 3,000 enrollments. So what we anticipate is year 1, we will offer 500 people the opportunity to enroll, and it may be the case that in order to fill all 500 enrollments, they might make it to number 727 on the waiting list to actually fulfill that 500. So we expect that by year 4, year 5, it's possible we may have already eliminated the waiting list before getting all the way to 6 years due to that declination rate. Okay. All right, so the end the wait process. We already have a bill title pulled in the General Assembly, and we're beginning the drafting process now. For those of you who don't work as closely at the Capitol, the budget work is happening now. The Joint Budget Committee has already begun their efforts to look at the governor's budget and analyze what, if anything, they want to change and how to balance it moving forward. But the actual legislative session begins in early January. So this work will begin in earnest with legislators then, although we're doing a lot of meeting with them now, including with the Joint Budget Committee. So we've had a lot of meetings with the Joint Budget Committee members, and for those of you who don't know, the Joint Budget Committee is comprised of 6 legislators, and many would argue that they are some of the most important legislators of the state because they set the budget for the entire state of Colorado. So they have a major impact on our ability to achieve this goal, and I'm really happy to tell you that we so far have a fair amount of support and enthusiasm from the Joint Budget Committee to pursue a solution this year to end the wait. We're still working with them to finalize what the nuance of that should be. Should it be 6 years, as we are proposing here, or should it be 5 years or 8 years? What exactly that should look like? A lot of it will depend on what's available within the scope of the budget. As we are meeting with legislators currently, we're accepting pre-file co-sponsors. So what that means is we're asking legislators to support this bill to the degree that they are willing to sign their name in support of the bill before it even gets introduced, so that on day 1 of the legislative session in January, we have a lot of names on that bill to demonstrate the power and support for this effort throughout the state. We do have a variety of barriers that are important to understand. First, our Governor Polis has some very clear budget priorities, and unfortunately, his budget priorities do not include ending the waiting list, at least yet. We are working with the governor's budget office, and we're working with his team very closely to see if there's any maneuverability within the scope of his priorities to help elevate this to the top. Currently, Governor Polis has, his campaign promises include funding full-day kindergarten across the state, and now this year he really wants to fund pre-kindergarten for everybody across the state. And those are really, really costly budget endeavors, and so those are his priorities right now, along with funding K through 12 education and some of the major transportation and infrastructure needs across the state. So there's no shortage of need, and we have to be cognizant of that because the cost of what we're asking for is pretty significant. It's also important to note that in Colorado, we have TABOR. TABOR means that in Colorado, there is a cap on the amount of money that the state can keep from taxpayers each year. When we hit that cap, the state of Colorado is forced to send any amount over that cap back to taxpayers. Most recently in the election last week, there was a ballot measure to ask Coloradans if the state of Colorado could keep the amount over that cap to spend on transportation and K-12 education. And the state of Colorado voters said, actually, no, I would like my money back. So the state of Colorado, every person in Colorado will receive probably between 28 and like 150 bucks back this year. From the perspective of our budget needs, you know, I think a lot of us who work in the disability space would have really valued if those dollars could stay within the state to help pay for things like ending the waiting list. Given that voters said that that could not happen this year, we know that we're facing a much tighter budget climate. Therefore, we really, really have a major grassroots campaign. We need your support to get this done. How can you help? We ask that you follow Alliance on social media and share our posts as much and as often as possible, both from your agency profiles and from your personal profiles. We are asking to please sign the petition. We're asking you to get your friends, your family, your neighbors, your mailmen and women, your dentist, everybody. We need this to be much, much bigger than just the disability community. We need this to be the state of Colorado telling our elected officials that this is how we should prioritize funding in the budget. This is how we want that moral document, our state budget, the moral document that says, here is what we value as a state. We need them to hear from every community that this is at the top of that list. Please, we're asking you, if you work for an organization or an agency, to, if you have power in that space, to please publicly endorse the bill. We're also welcoming individual endorsements from parents and families and friends. Endorsing the bill means we'll put your agency name or your name, if you're an individual, on our state or on our website publicly, meaning that your name or your agency name would publicly be endorsing the bill. Which is different than signing the petition. If you sign the petition, all of those names are only going to legislators. We're also asking that you contact your legislator. We are doing a 100 legislator outreach campaign, which means every single day we're targeting 1 or 2 legislators in the state, because every legislator needs to hear, and I mean really needs to hear from their community that this is a priority. They need to hear it from everyone across the state, but specifically they want to hear from those who are in their district that this is important to them. It has to come from you. Please, we encourage you to visit our End the Wait website, which is www.coidd.com. There are fact sheets and talking points and FAQs, testimonials, profiles of folks waiting, profiles of folks who have accessed the DD waiver and the impact on their lives. We really need your engagement, and this is a sort of clearinghouse for a lot of that information. You're always welcome to email info@alliancecolorado.org with any questions or comments, or if you want to get more engaged. And also we are asking as many people as possible to attend the waitlist hearing at the Capitol in the first 2 weeks of the legislative session, which will take place in January. They have not yet set the date for this, but once we have the date for that hearing, we will certainly be letting everyone who's signed up for this webinar, we'll send an email letting you know about it, and we're asking everyone to attend and wear blue so that they can see the impact and see the incredible power behind our collective voice and our collective desire to end the wait. All right, so the FAQ. We've received a variety of questions from our partners and from families and others, and so we wanted to go through a few of those for you here. The first question is, how will the rate increase be allocated? So as Ellen said earlier, all services that are not negotiated. So there are a few services that are negotiated. So some dental services and vision and some other things are a negotiated rate. So anything that is not negotiated, which is the vast majority of services, and those things that are paid on a non-unit basis, will receive the same cost of living increase based on the previous year's consumer price index, so that inflation measure. So this is the same across the board for all of these rates on the CES, SLS, DD, and CHIRP waivers.
So the next one that we've heard a lot about is, what about direct support professionals in this legislative proposal? For those of you who followed our efforts on HB 181407, and a lot of you, I assume, who are coming up on the reporting deadline for that law, know that that rate increase was specifically targeted at compensation for these frontline workers and their direct supervisors. So even though the increase that we're proposing in this legislation would not have to be spent solely on DSP compensation like that law, payroll is the largest outlay for IDD agencies by far. And as Emma talked about, the economic realities in Colorado today are really such that agencies have to, will ultimately have to put some of this increase toward compensation in order just to remain competitive and to be able to hire and retain their employees. So the other thing that 1407 didn't address, even though it made a significant difference for those frontline DSPs, it didn't help with wage compression issues at higher staffing levels or case manager compensation. We're hearing a lot from families about frustration with turnover and case management. It didn't help with increasing administrative costs like technology, building maintenance, or staff training. And so these are all critical aspects of delivering services as well. So this type of across-the-board increase can help with those, but ultimately it's important to remember that it will, to some degree, always have to be spent at least somewhat on compensation in order for these agencies to remain competitive in the marketplace.
Okay, so we got a question about, what about the 3,000 additional people who are on the safety net waiting list? So as Ellen described earlier, there's a difference between the as soon as available list, which is the 3,000 people we're targeting with this legislation. But what about the folks on the safety net? Well, so the safety net list includes not only those younger folks, folks who are between 14 and 18 years old, but also people who were previously on the as soon as available list and were offered a resource, and then they and their family decided, actually, we're okay for right now, and chose to decline the resource. So then they are moved to that safety net waiting list. So it's unclear how many folks on the safety net waiting list might switch to the as soon as available waiting list in the next 6 years. But basically, the goal here is to create an environment where right now, what we hear a lot in the community is that families are concerned, and when they are offered a resource right now, there's this feeling of fear that they have to take it, even if it's not exactly what they need in this moment. And so we want to create an environment where families can be certain that in the future, if they need a DD waiver resource, that it will be available to them. So we believe that ending the waiting list will help create that, kind of address that sense of scarcity from families, and hopefully create an environment that will allow for families to access the waiver as they need it.
Mm-hmm. Related to that, some people have asked, shouldn't we study the waiting list first? You know, it sounds like there's a lot of things that we don't know about the waiting list. And you're right, it's sometimes difficult to nail down an exact number and predict the needs of people who are on the waiting list because we don't assess their needs currently. And studying the waiting list is something that we've thought about, but there are a variety of technical and ethical questions to making a thorough study of the waiting list effective. And some of those things involve, you know, every individual who's on that waiting list is an individual. Everyone's circumstances are different, so sometimes it's hard to create a set of questions that will capture all of the variety and possibilities of reasons that they may or may not accept a waiting list or accept an enrollment when they're offered. The other thing is, you know, these people are waiting for services that they desperately need in many situations. So, you know, how would it affect them if we go out and ask them questions and sort of tempt them with the idea of having the ability to enroll when in fact they won't? So in recent years, we found that the best way to study is actually just to start enrolling people, because we've learned a lot from the last couple of years of enrollments that have been allocated by the General Assembly, and that's how we calculated that declination rate that we told you about. So we think that, you know, we'll be able to actually get a lot of data in the first few years of this effort by just simply enrolling people and seeing what happens and learning from them as they do go through that process.
Can the system handle this many new enrollees? You know, can we actually do this? 500 people a year for 6 years is pretty significant. You're right. This is a big lift for the system. However, that's exactly why we chose to do a 6-year buy down of the waiting list rather than attempting to do a 3-year buy down or a 1-year buy down. We know that we need to build capacity in the system, and so phasing it in over 6 years will help with that. But we, as described, we know with certainty we have to couple this with a capacity component. So we believe that tying IDD rates to inflation over the years will help to create some solubility, sustainability, and predictability for these provider agencies who work in this space. And with that, our sincere hope is providers will begin to move back into some of the service areas that they currently aren't able to offer services. And so we'll see increases in access, increases in continuity of care, increases in quality, and more.
One of the other questions that we've heard about is, what about waiver redesign? So for those of you who have followed systems change in the IDD world for a while, you'll know that there's been years of discussions about combining the 2 adult waivers, the supported living services and the developmental disabilities waivers, into one waiver that can serve the whole spectrum of adult needs. And this has been very difficult work. There have been multiple iterations of the group tasked with researching and making estimations for how this would work, designing the service coverage standards, etc. And there's still a lot to be figured out in that process and what it would look like and how we would help people who are currently on one of those 2 waivers make a transition to a new one. We are still several years out from what is the current expected timeline of achieving that goal. And that timeline or that end date has been pushed out numerous times already. So we really have a long way to go before fully understanding the impact of waiver redesign. But we know that over the last few years we've become increasingly aware that it's really difficult to combine one waiver that doesn't have any waiting list and one that does. So we believe that whatever waiver redesign ends up looking like, having a plan to enroll people on the waiting list will help ensure a smoother transition, hopefully, and that there will be enough resources to really make that happen in an effective way. So, you know, we're not aiming to change the process of waiver redesign right now in this proposal, but we are, of course, following it closely to see how these proposals might be related in the future.
And our last FAQ for today is, what about other disability services? So we absolutely understand that increases in the Medicaid reimbursement rates are needed in many disability programs, and that the economic factors we talked about, minimum wage, inflation, affect all of these programs. However, what we have seen and what we have learned is that IDD providers are uniquely reliant on Medicaid reimbursement rates simply due to the lack of cost-shifting ability, the lack of private pay, and the lack of private insurance in these spaces. Additionally, we're focusing primarily on intellectual and developmental disability because in 2014, as Ellen described, the legislature made a promise specific to the IDD community to eliminate the waiting list. We're simply trying to fulfill that promise. That law also called for recommendations for increasing system capacity because even then, in 2014, it was well known that this was an ongoing issue. So tying IDD rates to inflation is simply a first step to ensuring that capacity for enrollment for the 3,000 new folks coming onto the system.
All right. We are collecting questions that have been submitted through the chat box, and since we're coming up on the end, we may not have time to address those. Really quickly, we just wanted to mention that it is, of course, possible for service agencies that are listening and CCBs that are listening to become members of Alliance and get the most up-to-date and comprehensive information about this proposal. If you would like more information on membership, you can contact Kylie, our membership coordinator, and her contact information is there. And then finally, here's our contact information for me, Ellen, and Emma, our lobbyist, your presenters today. If you have any follow-up questions that you think of after the webinar closes, we'll be happy to try to either answer those directly or include them in the Q&A from this webinar when we send out the recording and the slides and all the resources. We're just going to check the chat box here to see if we have questions that we can answer right now. And it looks like we don't, so we must have answered everything. But as we mentioned, if you do have those last-minute questions that come up after we close the webinar today, please feel free to send them to us. Thank you so much for joining. Please stay tuned for our emails, announcements, our Facebook posts, our Twitter posts, and please get involved in any way and all the ways that you can to help us end the wait for IDD services.